Bismillahirrahmanirrahim. Okay, today the topic is cerebrospinal fluid. To discuss the cerebrospinal fluid, first we little bit review the anatomy of the meninges, which I have already discussed with you. So please give attention to this diagram. Look, this is the brain tissue. Look, this is the brain, medulla and pons and medulla, and then the spinal cord. You know, the brain and the medulla and spinal cord is everywhere covered by this thin pia matter which remains in close contact with the brain and the spinal cord. And then you look, this is the skull bone. And you know, the skull bone on the inner surface is being lined by this red endosteal layer of the inner layer of meningeal layer of the dura mater. Okay, the inner surface of the skull, this inner surface of the skull, it is being lined by the thick meningeal layer of dura mater. And the inner surface of the dura mater is then being lined by arachnoid matter, which almost remains in contact with the dura mater. So the arachnoid remains in contact with the dura and the pia remains in contact with the brain. In this way, this big space between the arachnoid and pia, this is being called as subarachnoid space. And this subarachnoid space, look, it always remains full with a fluid which is being called a cerebrospinal fluid. And what is the function of this fluid and where does it come from and where it is being produced, this we discuss. But presently you look, on one side the dura and arachnoid and another pia mater, between this fluid media which is present between the two, it actually produces a protective cushion between the brain tissue and the skull bone. In this way, this subarachnoid space filled with the cerebrospinal fluid, it provides a cushion for the brain so that the brain does not hit with the skull bone and may not get injured. In addition, the cerebrospinal fluid also remove the waste metabolites or waste products from the brain tissue to go into the venous system. In this way, cerebrospinal fluid function in two ways. Number one, it removes the metabolites, waste products from the brain tissue, and two, along with the arachnoid and pia mater, this cushion of fluid, it produces a protective mechanism for the brain so that the brain do not hit with the skull bone. Okay, in the same way, also in the spinal cord, between the arachnoid and the pia mater in this space is also lying the C.S.F or cerebrospinal fluid. Okay. Now you note one point that in the brain there are different cavities. For example, you can see this cavity. This is the third ventricle, and then you can see one over here. This is the fourth ventricle. Okay. Now, the roof of, let me say, this is one cavity in the brain. This is its floor, like let us say this one. This is the floor of the third ventricle, and this is the roof of the third ventricle. The roof of the ventricle is being lined by an epithelium or endothelial cells, which are secretory in nature, and which, like the endothelium in other parts of the body, This endothelium is not fenestrated, but they are being tightly being arranged with one another, or closely being arranged with one another. Now what happens present in the subarachnoid space, that is between the arachnoid and dura, there are blood vessels running, that is arteries and vein that runs in this area. In this area, the arteries and veins, it lies in the subarachnoid space. Now when these vessels, look again, let me say, this is the arachnoid and this is the pia mater. Over here is the arteries or blood vessels. These vessels now want to reach over here to the roof of the ventricle. What will happen, that this pia mater, like this, in this there will be folds. Folds will be produced, and the blood vessel, when it comes over here, it divides into tough capillaries in this area. In this way, the roof structure of each ventricle is having fold of pia mater, which is being called as tilla choroidea or tilla choroidea, and tough capillaries, and the inner surface of the pia over here is being lined by secretory endothelium. This combinedly, that is the tough capillaries and the fold of pia mater and this secretory endothelium, combinedly we call it as choroid plexus. Choroid plexus. And this choroid plexus is responsible for the formation of the CSF. The blood comes over here in the blood vessels and then in capillaries and comes into this pia mater, and then you know that the endothelium is very tightly packed, so that's why that all the contents of the blood, they do not enter into the brain tissue or into the CSF, but selectively some structures are being allowed to pass into this cavity of this ventricle, and some structures are being not allowed. That's why, for example, toxic material, big particles, toxins of the bacteria, they are not being allowed to be passed into the brain tissue or into the ventricles, into the cavities. And then this fluid is slightly being more modified by secretions from these endothelial cells. In this way, the CSF is actually the filtered blood which is being brought into this through these vessels and breaking into capillaries, tough capillaries, and then from this it is selectively some allowed, not allowed some structures, and then the fluid from the endothelium, it enters into the cavities along with this fluid, and this is being called as cerebrospinal fluid. Okay, and note the point that the content of the blood and the CSF are not the same, because I told you that this arrangement, the tough we call tilla choroidea and the tightly packed endothelium, it do not allow all the structures to enter the CSF. That's why the components of which are present all in the blood, all of them are not being present in the CSF, and the, for example, toxic material, toxins of the bacteria, etc. So in this way, the CSF, cerebrospinal fluid, is being produced by the choroid plexus. And the structure of choroid plexus, I hope now it is clear to you. Okay, but note the point that 70% of the CSF is being produced by the choroid plexus, while 30% is being produced by direct oozing from the walls of the capillaries from hair. Some 30% of the CSF is being produced directly from the vessels of the brain to some of the 30% of CSF is being produced by directly oozing out from the capillaries of the brain. Okay, but note one point over here, that the capillaries of the brain are again also different from the capillaries in the other parts of the body. Now look, that let me say, if this is one capillary of the brain, I magnify it, and the capillaries of the brain, the endothelial lining of these capillaries do not have fenestration or space. For example, in normal capillary, one endothelium over here and one over here, and there is a space between the two. But in the capillaries of the brain, there is no space, no fenestration. They are being tightly adherent with one another by azonole occludens. And then the basal lamina of this is also more thicker than the rest of the endothelium or rest of the blood vessels. The basal lamina over here in the capillaries of the brain is more thicker. And thirdly, the footsteps of astrocytes also being coming over here and making this barrier between the blood in the vessels and between the brain tissue. Brain tissue is being lying over here between the brain tissue, for example cerebrum, and the blood in the capillaries. There is lying between the blood in the capillaries and the brain tissue, there is lying one barrier. And this barrier is being made up of endothelium. Why? The endothelium is also present in other capillaries, but over here the endothelium is tightly packed, tightly arranged. There is no fenestration. Secondly, the basal lamina over here is more thicker than the rest of the capillary. And thirdly, the footsteps of the astrocyte also fills the gap. In this way, this barrier is being formed, which is called as blood-brain barrier, BBB, blood-brain barrier. This also the function of it is that it does not allow all the contents of the blood to enter into the brain tissue, maybe some toxins or any other toxic material which is present in the blood over here. They are not being allowed to pass through this blood barrier to enter into the brain tissue, but it selectively allows the only some structures and do not allow other structures. This is called as blood-brain barrier in the wall of the capillaries of the brain. But note the point, the blood-brain barrier is not being developed in neonates, in infant, in neonate, the newborn child. So what happens that if there is neonatal jaundice, if there is a jaundice in the newborn child, what happens? Because the blood-brain barrier is not well developed, that's why the jaundice bilirubin particles passes through the capillaries to enter into the brain tissue and damages the brain tissue, a condition which is being called as kernicterus. The child would be brought to you in this position, that the head will be touching the ground, the bed, and the foot will be touching, the body would be like this. This is being called as kernicterus. And then what we do the blood exchange, complete exchange of the blood of this child. But if this child survives, if the kernicterus is much more, then the brain tissue is being damaged, and the result is the brain damaged child or CP child, cerebral palsy child. The child is, then not full active or clever depending upon the damage being done by the bilirubin particles. Okay, this is blood-brain barrier, and this blood-brain barrier in the cavities of the wall, is also called as CSF blood barrier. You need the barrier between the blood and this CSF present in the cavity. That is also called as CSF, the CSF blood barrier. But normally it is being called as blood-brain barrier. Okay. Now, note the point. The CSF, almost 130 ml of CSF always remains in this subarachnoid space. 130 ml of CSF remains in this subarachnoid space. Okay. So I told you that almost 130 ml of CSF remains in this subarachnoid space, that is in the subarachnoid space of the brain and that of the spinal cord combined. Over here this CSF remains, and somewhat 500 ml CSF is being produced per day. CSF, some 500 ml is being produced per day, and the CSF is produced by the choroid plexus in the roof of the ventricles, and while some 30% of its the volume is being produced by the capillaries of the brain directly by oozing from that. And now this CSF function I told you in two ways, and then out of this CSF somewhat 30 ml remains over here, the rest remains over here in this spinal cord area, in this area remains. Okay, now our total per day production is 150 ml. Okay, 500 ml, sorry. Okay, now what is this circulation? Okay, so before going to circulation, I tell you, look, you can see this is the third ventricle, this cavity. Look, this is the third ventricle, while the lateral ventricle is present inside the cerebrum. If you open from over here, inside is present the lateral ventricle. Look, this is the cavity of the lateral ventricle. This one. This is the lateral ventricle, and this one is the third ventricle. And over here, you can see this is the fourth ventricle. Alright. Now the CSF, which is produced in the lateral ventricle, this one, as I told you, this cavity, over here in this lateral wall of the third ventricle, over here is one foramen. Over here, one foramen is present, which is being called as interventricular foramen. That is foramen from the ventricle to another ventricle. This one. This is interventricular foramen from this ventricle to this third ventricle, or also called as foramen of Monro. Foramen of Monro. Then the CSF, which is being produced bilaterally in the third ventricle of one side and another side, it from the choroid plexus, it comes out through this foramen of Monro into the cavity of the third ventricle. And then from the third ventricle, then the CSF, which is being produced by itself as well, then this fluid CSF flows from the third ventricle through this canal. Can you see this canal? Through this canal, which is called as cerebral aqueduct. And then from the cerebral aqueduct, this fluid ultimately comes over here into the fourth ventricle, and some fluid goes downward into the subarachnoid space of the spinal cord. Again, look the flow from the third ventricle through the foramen of Monroe into the lateral ventricle, from the lateral ventricle through this cerebral aqueduct into the fourth ventricle, and then some passes downward into the subarachnoid space of the spinal cord. Now note the point. Look, the roof of the fourth ventricle, it is tent shaped. It is tent shaped. You look over here. This is the dorsal surface of the pons and the medulla, and the tent shaped surface of roof of the fourth ventricle is like this. In this tent shaped roof of the fourth ventricle, there is one foramen in the center and one foramen on one side and one foramen on the lateral side, and fluid from this fourth ventricle comes out through this median aperture, which is called as the Meninges, foramina Meninges, and from these two lateral foramina, which are being called as foramina lusca. This is being called as foramina lusca. Look, one foramen in this, the medial point in the roof of the fourth ventricle, and this is being called as foramina Meninges, and one on the lateral side and one on the lateral side, which is called as like this. This is the pons, this is the middle. So one foramen over here, one foramen over here. These are called as foramina lusca, and one foramen in the roof, in the median of the roof over here. This is the floor actually, and that is being called as foramina Meninges. From this foramina lusca and foramina Meninges, then the CSF over here enters into the cisterna, which we call it as cisterna magna, cisterna pontis, and which is actually the parts of the subarachnoid space. In this way, the CSF from the ventricles reaches into this subarachnoid space, and this subarachnoid space always remains full with the cerebrospinal fluid of the brain, as well as the subarachnoid space of the spinal cord, that is between the arachnoid and the pia mater. This space remains full with the CSF. Now, and this provides, again I told you, the cushion for the brain, and also bring out the waste products. Now look again. Let me say that if this is the pia and arachnoid combined, and over here and over here and over here, you look this one. This is the superior sagittal sinus. Superior sagittal sinus. And now look again. This is the superior sagittal sinus, and over here is the arachnoid mater. Okay. Now over here and over here is the pia. This space is being filled with the CSF, cerebral fluid. Then you know, I have told you also in discussion of the Meninges that flanges from this arachnoid mater pierces through the small foramina in the dura to enter into this superior sagittal sinus, and this is called as Arachnoid Villi. That from this left, this is arachnoid, then one fold passes like this, and again, and this fold then enters into this superior sagittal sinus, and the CSF, which you can see over here, this CSF then passes through this arachnoid villi to enter into the superior sagittal sinus to be drained into the venous blood flow. The CSF from the subarachnoid space is being drained by the arachnoid villi and arachnoid granulations. It is one and the same, but when many villi get together like this, especially in the old age, then it is being called as arachnoid granulation. But if only one villus, that is villus, from over here blood, the CSF enters into the the superior sagittal sinus, and from that it goes into the venous blood. This is one mechanism in which the CSF is being drained from the subarachnoid space into the superior sagittal sinus. And in addition, over here in the anterior cranial fossa, over here, you know, there is a cribriform plate. In the anterior cranial fossa, there is a plate which is having foramina, which is being called as cribriform plate. And some CSF also passes through the cribriform plate into this nasal cavity or nasal tissue. And then some of the CSF from the spinal cord, over here from the spinal cord, when the nerves come out through the pia and arachnoid, some of the CSF through these nerves piercing, the nerve which come out from the spinal cord, goes also directly to the lymphatic system and to the nervous system from the spinal cord. But most of the CSF, it passes from the subarachnoid space through the arachnoid villi granulation into the superior sagittal sinus. In this way, the flow of the CSF is from the third lateral to the third ventricle through foramen of Monro, and from the third ventricle through cerebral aqueduct into the fourth ventricle, and also into the subarachnoid space of the spinal cord, and from the fourth ventricle through foramen Meninges and foramen Luschka. It passes into the subarachnoid space, and from the subarachnoid space through the arachnoid villi and granulation, it enters into the superior sagittal sinus, and in this way the CSF again goes into the blood. In this way, continuously CSF is being formed and reabsorbed, being formed and reabsorbed. Now, in this way, the CSF is also present over here, you know, in the spinal cord. That's why in some condition will take advantage that we take CSF from the spinal cord at the L3, L4 level from the subarachnoid space, and then we examine it under the microscope in the laboratory to find it that if there is meningitis or encephalitis or any other disease present inside the brain through CSF. Secondly, if there is somewhere blockage in this flow of the CSF, for example, blockage over here, or maybe blockage in the foramen Meninges, foramen Luschka, or maybe blockage from the subarachnoid space into the sagittal sinus, then what happens? The CSF being produced continuously in the cavities and not being drained, then the CSF being accumulates inside the skull, especially in the newborn. You would have seen a big skull which is called as hydrocephalus. That is actually because of obstruction of the flow of the CSF somewhere. And then hydrocephalus is a big skull. It then, if do not treat, then it can lead to brain atrophy. And then what we do, we put a tube over here inside from the skull into the ventricular cavity, and then brings it downward to put it in the peritoneum, which we call it as ventriculoperitoneal shunt or VP shunt, so that the CSF is being drained in this area, and then the hydrocephalus is being treated. I think this is all sufficient today for CSF formation and its circulation. Thank you very much.